Today's What's What talk is going to be about pain relievers. That's going to be presented by me, Jordan Bunnenhagen. Just a few questions before we start the presentation. What comes to mind when you think about pain relievers? What do you use them for? Why are you using a pain reliever? Maybe you have a cold. Maybe it's a general headache. Maybe general joint pain. What products do you use or that come to your mind with pain relievers? And then what have you heard about them? And maybe how do you use them? Are you using too much? Are you using maybe not enough? Just keep in mind before we go to the next slide, this information is intended for educational purposes only and should not be interpreted as medical advice. All right, moving on to the next slide. Here we go. All right, test your knowledge. True or false? Most over-the-counter pain relievers are available without a prescription because they do not have side effects. And that is false. Any medication can have side effects. And it's important to understand what medications that you are taking, how they work, and if there are any potential interactions. All right, types of pain relievers. Analgesic is another word for medications that help relieve pain and discomfort. There are several types of analgesics that work differently. Some products are available over the counter and without a prescription. These include acetaminophen, aspirin, ibuprofen, naproxen. There's also topical analgesics that are used for the area of discomfort. Some analgesics require a prescription, and there are two main types, opioid and non-opioid. Opioid medications come from opium and are very powerful. It is important to use these drugs carefully because misuse can be dangerous, especially with opioid drugs. Also, some prescription medications also contain the same or similar ingredients as over-the-counter analgesics. For example, you have acetaminophen, ibuprofen. Those can be prescribed as heavier doses. So it's important to know what you're taking. All right, acetaminophen is one of the most common over-the-counter pain relievers. Tylenol is one of the most recognized brand names of acetaminophen, as are Dayquil and NyQuil, but there are many others too. It is an ingredient in more than 600 different medications, both over-the-counter and prescription. It helps reduce pain and discomfort as well as reduce fever. Few precautions: do not take multiple products containing acetaminophen at the same time. It is found in many medications, including many cold and flu products. It's best to stay below a total of 3,000 milligrams per day. This may be still too much for some people. It's best to talk to a doctor before you take that much. There is a risk of liver damage with larger doses of acetaminophen and with long-term use. All right, another group of medications are the non-steroidal anti-inflammatory drugs. Common examples: aspirin, ibuprofen, naproxen. They can help reduce pain, inflammation, and fever. They're more commonly used for muscle aches and arthritis. Some other risks, though, that they pose: they prevent blood from clotting and may cause stomach bleeding if you take too much. There may be greater risk for people over age 60, those taking certain medications, or those with certain bleeding problems. If you are taking other blood thinners, check with your doctor before using these medications. They also may cause nausea, upset stomach, or an ulcer. So some more recent studies have also linked these medications, except for aspirin, to a higher risk of heart attack or stroke, especially those who already have cardiovascular disease. So some precautions: take with food to help the upset stomach. Stop taking immediately if a rash develops. Products such as naproxen and ibuprofen are in the same class and should not be taken together. All right, another form is topical analgesics. They come in the form of balms, ointments, rubs, and patches that contain pain relievers. They are applied directly to the skin. There are many types: counter irritants, and then some of your more popular ones: salicylates, icy hot, aspartame, Bengay, then capsaicin. Some of these create warm or cool feelings, so your mind is less focused on the discomfort. Others are absorbed into the skin and work in various ways. They may help with minor muscle aches and pains. A few precautions before you use these. Apply through massage for added benefits. Do not use on open wounds or skin. Avoid contact with eyes, face, groin, and armpits. Definitely armpits. Don't think it's deodorant. Never use with heat. They may cause a burn. And then always wash your hands after applying a topical product. Check with your supervisor before using at work.
All right, biggest thing with all these medications is definitely to read the label. The label on over-the-counter medicines is a great place to find information. The FDA requires drug labels to have certain information in this order. Number 1, active ingredients. What ingredients make the drug work and how much is in each dose? This is where you'll find things like acetaminophen, ibuprofen, etc. Number 2 is purpose. What is the purpose of this medication, such as pain reliever, reduce swelling? Number 3 is uses. Why would you take this drug? 4 is warnings. Explains when not to use the drug, possible side effects, and when to talk with your doctor or pharmacist before using. 5 is dosage. Provides directions on when and how to take the drug, including how much to take. 6 is other information. Often lists important information about how to store the drug. And then 7 is inactive ingredients. These are other ingredients in this product. It's important to look at these, especially if you have allergies to any of the certain substances in the medication. All right, important precautions to keep in mind before using any medications. Talk with your doctor and pharmacist and make sure they know everything you take, including over-the-counter and prescription drugs, as well as supplements. That is very important too. They can help you avoid interactions and make sure you're taking medications correctly and safely. Use medications only as directed by the label and or your doctor. Use the lowest dose that is effective for the shortest time necessary. Talk with your doctor before using any drug long-term, including those you can buy over the counter. Dispose of old or unused medication properly. For most, it's best to take them to a drug take-back program in your community. Check with your local police department or pharmacy for more information. A couple do nots. Do not mix multiple products with the same or similar active ingredients. Examples: do not take ibuprofen and naproxen at the same time, since both are non-steroidal inflammatory drugs. Do not take multiple drugs at the same time that contain acetaminophen. If you're not sure if 2 drugs can be used together, ask your pharmacist. Never share prescriptions with others. And what if you have questions about non-steroidal anti-inflammatory drugs and analgesics? Your doctor is a great place to start. Also, pharmacists are a wealth of information and happy to answer questions. For certain questions, a nurse triage line through your clinic or health plan may also be able to help or provide additional information. At work, you may be able to reach out to your safety or injury prevention team if available. Some companies also have occupational health nurses who may be able to answer some questions. And then what do you do next? What is the next possible steps to help you use pain relievers safely and effectively? First, read the label before taking a medication. Seems like common sense, but it's good to know how much of a dose you should take for your body or your age. Also, dispose of old or unused medications properly, and then talk with a professional about medications that you may take. As stated before, it is very important not to mix and match medications. Thanks for watching today's What's What on pain relievers. Thanks for participating. If you would like to leave a comment below on when you watch this, that'd be awesome. If you need any more information, please email me at jordan.budenhagen@bestbuy.com. If you need to figure out how to spell that, go all the way back to the first slide. My name should be on that, or just contact me on Facebook. That's pretty easy. All right, thanks again and have a great rest of your day.